to the questions from earlier about messaging, whatever happened to President Biden's promise to shut down the virus?
We're working on it, Peter.
There's another variant here. Is the idea that you want people now to kind of wrap their heads around that the president, instead of shutting down the virus, is going to try to help people live amidst the virus and go about their lives, but COVID is going to be here?
Well, Peter, what's very important for people to understand, and all of you are communicating to the public about what steps they can take to go back to normal or go back to normal life, something everybody wants to do. We're all sick and tired of this virus. But we need approximately 20% of the population, or more people than are currently vaccinated, to go get vaccinated and go get boosted. What we can do as the federal government is make those vaccines free, make the boosters free, make them available. The president will talk more about what we're going to do tomorrow, but we need the American people to do more who are not vaccinated to help us continue to fight the virus.
A lot of talk about the first Trump-Biden debate today, but at the second one, in 2020, when roughly 220,000 Americans had already died of COVID, Joe Biden said about Trump, anyone who is responsible for that many deaths should not remain as president of the United States of America. Is that still the standard now that more Americans have died under President Biden than President Trump?
Well, I think the fundamental question here is, what are you doing to save lives and protect people? And the former president was suggesting people inject bleach. He apparently, reportedly, didn't even share with people he was going to interact with that he had tested positive for COVID himself. He continued to provide a forum for misinformation, which probably led to people not taking steps forward to protect themselves, to wear masks, to eventually get vaccinated. This president has made the vaccine widely available. He's relied on the advice of his health and medical experts, and he is trying to be a part of solving this crisis, getting the pandemic under control. And I think there's a pretty stark difference between their approaches. Go ahead.